All right, good afternoon, everybody. Here with Josh and Paul. I'll get a chance to reintroduce Scott Gottlieb to you in a minute. First off, just quickly, daily COVID summary. Pleased to see that our infection rate is still below 1%. To be exact, it's 0.009953, so it's barely under 1%. Number I've tended to look at. And the death are lingering, which is disturbing. Next chart, I think you've seen, many times. It's our total hospitalizations. It just wants to give you an idea of how much capacity we have in our hospitals in general, because the next slide will tell you what that could be at risk. The next slide shows you the adult ICU bed usage in Arizona and Florida. And I think you'll see that Arizona went from 50% availability to 100% occupancy in less than a month. And Florida ramped up, and they both have zero capacity at this point. They're moving people around. So it just reminds you why early on I cared so much about hospitalization in terms of capacity we have there. Obviously, right now we're blessed with a lot of capacity. And this chart just reminds you how fast it can change. This next chart is a little new one we've done. The new cases by age. We haven't broken it down by age before. I think you'll be interested to see that 20 to 29 is the biggest cohort in terms of years where people have tested positive for COVID. This is just in the last week. I will tell you, if you look over the extent of the last 90 days, 20 to 29 was not the highest in terms of age-related COVID, but it was only the fourth highest. And you look at over 80, you see where that is now. Before, it was the second highest. So it gives you an idea of how the COVID infection world is changing a little bit, where those, say, over the age of 50, their rate of COVID infections is going down as a percent of the total, I think reflecting on the fact that they're perhaps a little more serious about wearing the mask. And those in the 20 to 29-year-old cohort, that's where the surge in infections has been. And I worry about that because I think we saw that's how things started down in Florida and Arizona and other places as well. Just to tee up Scott, I'll tell you, it's been 24 hours of two sides of the same coin. I just met with the event planners via Zoom. It's hundreds of folks who make a living off of weddings and big banquets, and their business has been devastated. And they're just, anxious, pleading. What can you do? Let us get back. I got a big banquet hall. Let us have, a nice event. Maybe do some things. We'll be extraordinarily careful. And I just told them that we're leading every day with public health as the defining lens through which we measure everything. And I talked to Senators Murphy and Blumenthal today at an event. And we said, look, there's well over $100 billion in PPP, the Paycheck Protection money, still there on the books. They haven't been spent. We've done very good here. About 50% of all of our small companies have already gotten those loans. And all these event planners also got some loans as well. But as you know, as we move through July, those PPP loans are running out for companies like that. So I'm working with Chris and in terms of how we can maybe make those PPP loans available to businesses that are still shut down for another period of time, so people like the event planners can get a second winds, allow them to power through for the next few months, and hopefully things are turned around and they're available again. So anyway, the event planners desperate to get back to work and said everything we do, we got to do through a public health lens. We're going to have to wait a little bit longer. And on the flip side of that same coin, I spent a lot of time talking with teachers, which is where I want to focus a little bit today. We put out our plan now, it's well over 2 weeks ago, in terms of how we think we can get back to school safely. Number one, safety first, everything through that public health lens. We've shared that with the public health professionals far and wide, trying to get their best point of view on how we're doing and how I can convince parents and how I convince teachers that everything we're doing puts their public health first. You know, for the parents, we have a little more flexibility, as you know, because we're saying, look, if you don't feel confident with your kid going back to school at this point, we have stay-at-home options for them, and Nick Simmons is working on how we can get them the laptop, make sure you have a Wi-Fi zone and get you the access. So we've got pretty good capacity there. And there have been some early surveys coming out of Stonington and Fairfield and other places where it looks like probably 15 to 20% of the parents may want to take advantage of that homeschooling option to start off. And obviously that would open up more social distancing within the classrooms as well. And for the teachers, you've got to know I've got your back. Everything I've done to date, we've erred on the side of caution. As you know, when it came to reopening, we were slow to reopen. We waited for the metrics to be right. And if any state can open safely, I think it's Connecticut, given the fact that we still are under 1%, barely under 1%, under 1%. And I'm going to do everything I can to give you the confidence you need when it comes to masks, when it comes to disinfecting, when it comes to social distancing, when it comes to cohorting, to make sure that you know that you can get back safely, if it's okay by a doctor for you to get back. And with that, that's why I'm leading with the science. And as you remember, a couple days ago, we had Dr. Carter on board, chief epidemiologist from the state. Next week, we'll have Dr. Coe back, all opining on our plans as we reopen and what we're doing right and what we can learn from. And with that, I'd like to introduce or reintroduce to you Scott Gottlieb. Scott has been a leader on this COVID crisis since the very beginning, always erring on the side of caution, putting public health front and center, and working hard to convince all the major stakeholders how we can get this right. And I'm fortunate to tell you that he's a dad with kids in the Connecticut schools, and that's why he's taken a particular interest in our great state. Scott, any thoughts on reopening?
Well, thanks a lot, Governor. I appreciate the opportunity to be here with you today, and I appreciate the dialogue that we've had through this difficult time. I wanted to share some thoughts on schools. You know, this state's worked very hard with a diverse set of stakeholders to craft a plan that I think tries to lean forward to return kids to school for at least as far as we can get into the school years possible, while providing for the safety of children and teachers and families. And, you know, these are, in my view, very hard decisions, maybe the hardest decisions we're going to make. And I don't think any plan is going to be perfect. And a lot of what we're going to do is ultimately going to depend on the circumstances that exist in the fall. And it's hard to predict where we're going to be with any certainty in the fall as this infection evolves around the country. But hopefully we're going to have the opportunity here in the state, and I think we will, to bring kids back, at least for a period of time. May end up having to close the schools at some point in the fall, winter, as this epidemic takes its course, but we're going to have the opportunity to bring kids back. And I think even if we can bring them back for a period of time, that's going to be exceedingly important. It's critical for their education, their social well-being. It's important for families to try to get kids back into school. But it's important we do it with precautions to prevent outbreaks in the school setting. And we're doing that here in the state with the plan that you put forward, Governor. And that means a number of things. It means parents should be given a home option. As you've said, I believe parents are in the best position to know what the risks are to their children. And some children are at higher risk than others because they may have asthma or other health conditions, and parents should have that flexibility as they will have in the state. I think it's important we keep social networks small as you prescribed in the plan, have children stay with the same defined cohort. This is something that was done in a lot of European countries as well with success, and try to keep those cohorts as small as possible. So that way, if you get a single introduction of infection into a school setting, it mitigates the risk that there's going to be a large outbreak. Masks clearly reduce the chance of spread. They protect you from me, they protect me from you, and it's especially important in the school setting, and that students be taught how to use them properly. I think it's especially important also for teachers who may be at higher risk from infection, that they should have proper protective equipment. We need to protect the teachers. They're really frontline providers in these settings. And while there's evidence that children are less susceptible to contracting the virus, there's where the data is less certain is on their ability to transmit the virus. The data there is mixed. And while some studies show they're less likely to spread infection, other studies show they may be just as likely to spread the infection. So we need to make sure we're protecting the teachers in these settings. And we need to have humility about this virus and appreciate that we don't fully understand it. And we're learning a lot as we go. We've both underestimated and overestimated COVID along the way. And so we need to understand that there is risks that we don't necessarily understand. And then finally, final point, what we do is going to depend on the overall risk in the setting. We need to acknowledge that while the data shows children may be at less risk from COVID than adults, less risk doesn't mean no risk. And we've deliberately sheltered the children to date. And so the overall infection rate among kids may be rather low. And other countries that reopened their schools did it with strict measures in place. They did it against the backdrop where they controlled the spread. We face different circumstances in the U.S., so we need to be careful that we take steps, as we're doing in this state, to try to control outbreaks, acknowledging that we don't know everything about this virus, and we don't know everything about the risk to children in particular. So we need to be cautious and proceed with caution, and we're doing that. And so I just want to thank you for the opportunity to be here today, Governor, and try to be helpful to the state. I have a lot of confidence in what we're doing. My kids are in public school in the state, as you know, and I feel very good about what my local officials and state officials have done to date to try to protect us all from this virus and address these risks.
If I could ask the first question, Scott, what can we learn from Europe, where I understand schools have been open in many cases for a month or two with very low risk of flare-ups, not flare-ups to date. But then I read in Israel there have been some flare-ups. What can we learn from those examples?
When you look around the world, different countries did different things. A lot of what they did with success or success to date are things that we're baking into the kinds of plans that we're doing in this state and other states are doing. In China, schools reopened early May, but children had to pass through temperature checks and wear masks. And enter and leave at specific points. They controlled the flow of the schools. In the Netherlands, they cut class sizes in half, but they didn't enforce distancing measures. Other schools adopted a pod model or cohort model, as we're doing in this state. Denmark was the first country to reopen schools, and they did this. They assigned children to small groups that could only congregate with small groups. Finland kept classes normal size. They didn't cut class size, but they had students in those defined cohorts. Denmark became the first Western country to reopen schools. April 15th. They maintained a sophisticated sort of monitoring system in their schools to try to detect any increased infection, identify the likely outsource, and also try to control social interaction in the schools. Israel, as you mentioned, reopened schools, had large outbreaks. They didn't do a lot to try to control cohorts or to de-densify their schools. And their schools are sort of the physical plans of their schools. They're known to be crowded, and so it was a high-risk condition. And so a single introduction was able to lead to large outbreaks in that country.
Hey, well, thank you. And your kid may be downstairs on Zoom because your audio is breaking up just a little bit if you have connection there. But Max, any questions?
Fox 61.
Hi, Governor. Zania Maldonado from Fox 61. You mentioned that new cases by age just this week, biggest group ages 20 to 29. What's your message to that age group right now? And could you also talk about, is there the potential possibility that this age group could, I don't want to say ruin things, but come September really inhibit the success that Connecticut has had so far?
Well, I think the younger age group, like the 20 to 29, which has spiked up, as you point out, in terms of those infections, are a little more casual when it comes to wearing the mask and close contact socializing. So I think that is a worry. I know how frustrating it's been. I know now it's July. I know we haven't seen your friends in quite some time. You're making up for some lost time. But I was telling you, when you look at the numbers in Connecticut and you look what's going on around the country, especially in those southern states, that could be a canary in the coal mine. So please, please be very careful.
And then also in that chart, we saw that the second age group for new cases is 30 to 39. And the average age of the Connecticut teacher is, I believe, 30 to 49. So is there some concern around, teachers, we're talking about it today, and them having a higher risk of getting COVID?
I think it's risky behavior that gives you those numbers. And, the older you are, the more cautious you are, I guess. That's one of the things that comes with age. So when it comes to teachers, I'm less concerned because we are going to be so careful in terms of making sure those protocols are followed, starting with the kids as well as the teachers, the masks, and the other requirements.
NBC Connecticut.
Hi, Governor. Matt Austin with NBC Connecticut. A new poll out of Quinnipiac just yesterday found that about 60%, 62% of people said it would be unsafe nationwide to send students back to K through 12 schools. I mean, the school year is not that far off. How do you give that number of people the confidence to send their kids back so soon?
Well, when you say so soon, remember we've had a couple weeks of 1% or less. We've had declining metrics for the last couple of months. Let's say we started reopening a couple of months ago with some restaurants, outdoor, and stores. It was a month ago now that we did some indoor dining and some other venues. So I don't think it's so soon is how I would phrase it. But you're right. I'd be very cautious if I was down in Miami Beach right now about having my kid go to school, given the fact that they have an infection rate that could be 25 times our. We're in a very different situation, and I think that national poll maybe reflects some of that.
And then for a question for Scott, in terms of the number of states where we've seen such a spread of COVID recently, at what point do we have growing concern here in Connecticut that could transfer or spread cases here and especially affect the fall and the school season?
You know, it's hard to say. Anyone who thinks that they can predict the next 2 or 3 months with any precision, I don't think you can. I think at some point there's a risk that we're going to have a confluent epidemic across the United States because we have a lot of infection. We're taking an awful lot of infection into the fall, and it's going to collide with flu season when it's going to overwhelm our ability to do effective testing. I do think in this state, you know, in the Northeast, where we've sort of brought the levels down very low, we're likely to be quiescent for a period of time. I think we've bought ourselves a couple of months probably of low levels, but we're getting introductions right now, and eventually we're going to have chains of transmission. Now, hopefully we have enough testing and tracking and tracing in the state that we're going to be able to detect it early, try to contain outbreaks, but eventually there's going to be a risk that this becomes a confluent epidemic across the United States as we enter into flu season.
And just briefly, can you give us an overview of where we are with vaccines? How confident are you that we're going to actually have the distribution also to get the vaccine out effectively? I know we've run into a lot of issues with testing.
I think we're going to have the ability to distribute the vaccine. In 2009 with the H1N1 season, we effectively made a trivalent flu vaccine, and then we manufactured a couple of months or several months later than that a monovalent vaccine for H1N1 swine flu. And we were able to both manufacture and distribute that flu vaccine. So we had the capacity to basically create a sort of double supply of flu vaccine that season, get enough injections, be able to deliver it effectively. So we've done this before. We should be able to both deliver a flu vaccine this fall, winter, and then deliver a COVID vaccine if we're fortunate enough to have one. I think the reality is that having a COVID vaccine is likely an early 2021 event and sort of an optimistic scenario. I think it's unlikely we're going to have a vaccine available in 2020. If it is available, it's going to be available for limited use under an emergency use authorization, probably. That would be my best estimate. It's possible we'll have data from the pivotal trials with the vaccine sometime in October in sort of an optimistic scenario. And partly that could get accelerated because I think enrollment in these trials is going to go quick. There's going to be a lot of people who want to enter these trials. And frankly, the United States is unfortunately a very good place to be conducting a vaccine trial for a COVID vaccine right now because we have so much infection. We have a lot of cases. And so these trials are going to be able to determine more efficiently whether or not these vaccines are effective because you're going to have a lot of cases in the control arms of these trials to know whether the vaccine's working. So we could get an early answer on the vaccine. And the final point is, remember, the manufacturers are manufacturing these vaccines right now, or they're going to start manufacturing them at risk. And I'm on the board of Pfizer, as many of you know, which is one of the companies with the vaccine. But the manufacturers have said publicly they're manufacturing these at risk. So we're going to start having supply and doing lot release maybe as early as late summer with these vaccines. So by the time one of these is either authorized or approved, you're going to have some supply on hand that you can start distributing.
News 8.
Governor, we understand that things could change pretty drastically over the next couple of weeks. But is there a scenario where we get into August, we have not gone into phase 3 yet, but is there a scenario where you would still maybe have school start on time with as many kids in class? Or would that phase 3, if it's still not, still in pause, then you wouldn't look to go forward?
I think those are two separate items. Phase 3, as you remember, was bars, nightclubs, occupancy and indoor dining. And those are things we decided to put on pause because we thought, talking to every other governor in the country, that those are very infectious, especially in the bars. I would not put the schools in the same category at all. I think we have a situation where we can control it a lot better. We can cohort, as Scott said, and we can make sure that masks are required. And I think that will make it a very different environment than the other phase 3.
Can I ask you a question about, with respect to the lottery as well? I know there had been talk in the past couple of years about going online, and certainly maybe during this time, it looks pretty good. Is that something that will come up again in the near future?
Probably come up not in a special session, but perhaps in the regular session. We've had a number of conversations with both Mohegan Sun and Foxwoods. Thinks this is a good time to be thinking about the iLottery, but there's some legal things we have to make sure we do it in a way that doesn't invite litigation.
Channel 3 Eyewitness News.
Yes, question for the governor. Last week we talked about air filtrations in schools, possibly adding HEPA filters or UV light. Have strides been made during this week to kind of get these things in the schools?
Yeah, let me start with that, then maybe Scott and Josh can help out. It's regarding air filtration systems, and we are out there doing an analysis of all the schools right now, seeing the nature of their airflow and what type of filters we might be able to get installed, because we think it could make a difference. And I think it's going to probably take us another 2 or 3 weeks to get a response on that. But do you guys have any thoughts on the level of importance on air filtration? Maybe Scott?
Yeah, look, I think that this is something that could be helpful and would be important if it can be achieved. I mean, the fact that kids are going to be wearing masks and teachers will be wearing masks in the schools mitigates the risk, but the filters would certainly be another additive measure that could be taken. The reality is we talk about COVID being airborne, whether or not it's aerosolized or whether or not it's droplet transmission. And the truth of the matter is that what it probably is droplet transmission that in optimal circumstances can spread through means that approximates an aerosolized virus. It's not truly an aerosol virus like measles or tuberculosis, but under the right circumstances, it can spread to a pattern that looks a lot like an aerosolized virus. And what are those circumstances? Those circumstances are indoor settings where you have people in congregate settings and you have poor air circulation, or you have air circulation that's sort of optimized for spread. And some people are speculating that maybe air conditioning units with poor circulation can be sort of that optimized setting. That's where you see bars or other settings like that become the focus of outbreaks. And so anything we can do to improve air quality indoors and congregate settings is going to be important. And the HEPA filters and other kinds of filtration devices can certainly add to the measure of protection that you're affording students and teachers.
And Mr. Gottlieb, can I get your thoughts on high school and collegiate sports in the fall? Can football, for example, be done safely at the high school level?
Look, I think I've been talking to some of the pro teams, and I think that they're going to be putting in place very strict measures to try to both test athletes and control, create a protective bubble. I think when you're talking about sports where people are in close contact and risk of spread is high, you need to try to create a protective bubble around the athletes in those settings. And it's harder to do at the collegiate level, and it's even harder to do at the high school level. So I think that is going to be challenging. At the pro level, they have unlimited resources to put in place some kinds of measures. Other levels, not so much.
CT News Junkie.
Thanks, Max. Governor, I wanted to know what your thoughts were. There are some members of the House who are still pushing for a workers' comp presumption for COVID-19. What are your thoughts on adding that to the special session agenda?
When we met with the leadership a couple days ago, we agreed together that we were going to focus on just the 4 items that we put forward. And my understanding is we're going to keep things limited to that right now.
Is it possible it could come up in September?
Oh, very possible, yes.
Thank you.
WTIC 1080 News.
Hi, following up on the high school football question, Mr. Governor, you know people love their high school sports. New York has now postponed its fall season. That just came out in the last hour or so. And New York has canceled the fall sports championships for high school. You've done a lot in coordination with New York State. Is that something you're looking at?
Well, we'll be talking certainly to the sports leagues, help them take the lead on this. You know, my instinct is at least you're not traveling to high infection states. High school sports is at least limited to a state where you have a very low infection rate. But I think I'll follow their lead. Any thoughts on that, Paul?
Commissioner Cardona, as you know, is part of our reopen strategy, as well as with the education plan, said that they're going to be working directly with CIAC and the relevant sports leagues within the state. So I know they're in close contact. We were aware of the action taken by our neighboring states and have been in conversations directly with those governor's office about those actions. So we will be continuing to work with the CIAC as we look at our infections rate, as well as looking at our overall reopening of our schools.
And Doctor, I would just ask you to, we all have to mute our microphones after we ask our questions so we can understand you. So just can I ask you to repeat your answer on high school sports? If you can get your IP back. I was just going to ask the doctor to repeat your answer on high school sports because the questioner didn't use his mic and couldn't understand you.
I don't think Scott could hear us there, but we'll get you that response.
Scott Gottlieb, can you hear us?
I can hear you, Governor. I couldn't hear on the other end. There was some
if you could repeat your answer regarding high school sports.
Yeah, look, I don't have a lot of expertise here, so I'll just say that up front. I think that there is a lot of risk in when you have children in close contact doing athletics, the risk of spread. You can't social distance, you can't wear a mask. And so in those settings, you want to try to create a protective bubble around the athletes. And so if you look at what the pro teams are doing, they're testing constantly. So they're going to be testing athletes, on a regular basis. Some of them are doing testing every day. They're bringing point-of-care diagnostics into the locker room. They're going to control behavior off the field. You look at what the NBA is doing or what Major League Baseball is doing. Colleges are trying to adopt some of those measures. They're having a harder time. They don't have the resources to do that level of testing. I think it's going to be even more challenging to do that at the high school level. And so, quite frankly, I would prioritize getting students back into the classroom before I reintroduced extracurricular activities. I think that the most important thing is to get students into the classroom, try to restart classes, see how that goes before we reintroduce other elements of risk that could lead to outbreaks at the high school level. Because it's going to be harder to introduce the kinds of safety measures around the kids at the high school level that you see pro teams and some collegiate teams doing.
The Associated Press.
Thank you. Along the lines of football, Governor, UConn football currently has games scheduled this fall in North Carolina, Virginia, California, and Mississippi. If things don't get better in those states, would the team be required to quarantine after they get back from those games? And do you even anticipate allowing teams to travel for football, baseball, or other sports, college level?
Well, my feeling is if you go to a highly infected state that still is part of our quarantine, that would be the requirement. As Scott just said, sometimes these teams live within their own bubbles. That's a form of self-quarantining, but I'd be reluctant.
And Dr. Gottlieb, the Maryland governor, Larry Hogan, who's a Republican, and some other governors have said that President Trump has left their states vulnerable to the pandemic, and they have to deal with this surge on their own. And they're saying that the lack of a national strategy could mean that we could be in this crisis for a while. What do you think of that?
Well, look, I think what you have in this country are state-based strategies in terms of how we're addressing the virus with regional effects. And so you're seeing regional epidemics and state-based strategies to try to address them. In some parts of the country, you're seeing states come together to try to adopt strategies as a group. You see that in the Northeast, but that's the reality. I mean, that's the reality of the policy approach that we've taken in this country. And in some respects, it's allowed states to tailor solutions to their individual challenges and their individual resources. And in other states, it would be preferable to have a more coordinated national approach, particularly when it comes, for example, to testing, where we don't really have a surge capacity that we can move around in this country to try to get testing into hotspots. And you're seeing, as a consequence, Texas, Arizona, Florida, seeing their testing capacity get overwhelmed.
And regarding testing capacity, we're hearing reports in some parts of the country, 7, 10, 14-day time frames. Is there anything the federal government can do to shorten the amount of time it takes to process a test?
In the near term, no. I mean, in the long term, we should be building some, sort of residual capacity that we can move around into hotspots, some surge capacity. Right now, the only real swing capacity in this country where you can get more testing into those hotspots is the large commercial labs like BioReference Labs, Quest, and LabCorp. And so they're moving capacity into those markets because that's where their biggest public health demand is. And what you're seeing as a consequence is wait times for tests go up in other parts of the country because their labs are focusing their resources on the places where the most urgent public health need is, which is right now Florida, Texas, Arizona, Alabama, California, Southern California.
And did you say swing capacity?
Swing capacity. I'm sorry. My sound might not be that good. Yeah.
Okay.
Surge capacity, yes.
Okay, surge capacity. I get that. All right. Thank you very much, Doctor. I appreciate it.
The Connecticut Mirror.
Dr. Gottlieb, based on what you're aware of that's going on now in the area of research, do you have any thoughts on what we might reasonably know by the end of the year about this disease and what makes sense on how we should be living versus, what you're struggling with now on issues about how to safely send your kids back to school?
Well, look, I think we're going to have a better sense of the overall risk in children. We right now believe that kids are at less risk from this infection, but it's hard to quantify that. And we don't know how many kids have been infected. If you look at influenza in the 2018-2019 flu season, flu infected 11.3 million kids. It caused symptomatic illness in 11.3 million kids, and probably caused asymptomatic or mildly symptomatic influenza that didn't get reported in millions of others. And so let's maybe assume 15 million kids became infected with flu. We hopefully haven't infected anywhere near that number of kids with COVID at this point because we've deliberately sheltered the children, and we don't want to. We don't want to find out what would happen if 15 million kids became infected with coronavirus. I think we're going to have a better sense of what the overall risk is to children. It appears to be lower, and it probably is lower, but we don't fully understand that. The one reliable study evaluating symptomatic COVID in kids, so these were kids who developed the infection and became symptomatic, and there's a lot of data showing kids are less likely to develop the infection and become symptomatic. But for the kids who did, it was a study of 2,100 kids out of Wuhan in China, and showed that 5% developed severe disease requiring supplemental oxygen, and about 0.6% developed critical disease requiring ICU, so multi-organ system failure, acute respiratory distress syndrome, shock. Was 0.6%. And this is probably the most reliable study looking at the experience in children of symptomatic COVID. And it's actually on the CDC's website, and the CDC identifies it as probably the most reliable study. I forget the exact terminology of how they point to it. Now, these are kids who develop symptomatic COVID, and there's various data showing that maybe only a third, kids are a third as likely to get infected, maybe as low as 20% as likely to get infected relative to adults. So it's probably the case that kids are less likely to get symptomatic COVID. But the question is, when they do, could they get sick? And I think the answer is yes, they can. Low risk doesn't mean no risk. And I think we need to be cautious because we don't fully understand, what the true experience would be. And the final point I'd make is that, remember, here in the U.S., we oftentimes compare ourselves to Europe. Here in the U.S., we have more comorbid illness among children. We have higher rates of asthma, of diabetes among children. And so it's probably the case that they have higher risk overall relative to some of our European peers.
And look, what metrics are you going to be looking for this fall when it comes to your decision as a parent about either removing your children or advising the local school board that you need to go to a different model, whether it's coming in shifts, some of the other options that have been discussed?
Is that question to me or to the governor?
Oh, no, that's to you.
Yeah, that's to you, Doctor.
And so the question is, what would you look at come the fall to make different decisions about schools?
Look, you're a scientist and you're also a parent. So ultimately, when you're looking at your own children, you've got to decide what in your gut makes you feel comfortable. So what are those metrics as far as your own kids that would make you say, no, I'm not comfortable with my kid being in public school right now, and I'm either going to pull them or I'm going to advise the local school board to go to, options, B or C about, the things that have been discussed.
Yeah, look, it's going to come down to what the prevalence is and whether or not there are outbreaks in the state, and particularly there's outbreaks in my local community. And where that threshold is, it's hard to say. I think we're going to know it. It's the sort of thing that we're going to know it when we see it. But I think if there are outbreaks in the state, outbreaks in the local community, that would be a point at which I would decide to pull my kids from the school. Now, I'm going to make every effort to start my kids in the school. I have a lot of confidence in the way the state's made decisions and the way my local district made decisions early on in this epidemic. They were early and prudent in terms of how they approached the school issue and made a decision to close the schools. And so I have confidence that the state's going to make good decisions and the local school district's going to make good decisions about if the point in time comes that we have to close the schools. And that point may come. I mean, I would think that at some point this is going to become epidemic again in some fashion in the Northeast. We just have so much infection around the country. But if we can get 2 months of school in, if we can get 3 months of school in, even 1 month of school in, that's going to be important. Bringing the kids back, socializing them, getting them introduced to their class. So if we do have to go to a distance learning model for the remainder of the year, it's going to be more effective. The reality is, I think that we have 6 more months with COVID. We bought ourselves a couple of months in the Northeast because of the mitigation steps we took of relative quiescence. Hopefully we can extend that as long as possible. But this is going to be touch and go between now and the end of the year. I think by the end of the year, there'll be a sufficient number of people who've been infected that we have some level of immunity in the population, and hopefully we'll have a vaccine in early 2021. So there is an end. There is a backstop. But we have 6 more months to get through, and we need to get as far as we can to those 6 months and get as much education in as possible before we might have to shut down again.
The Democrats are doing a virtual convention. The Republicans announced today they're going to have limits, only delegates, at least for the first 3 days, no alternates, no guest. What would your advice be to somebody who asks you, Doctor, should I go spend 3 days surrounded by 10,000 or 15,000 people in an arena in Jacksonville?
Well, look, I don't know exactly what the plan is that they've prescribed to try to reduce the risk. My advice to anyone would be to try to avoid congregate settings in locations where there's epidemics, if you can. I mean, I wouldn't be going into settings, congregate settings, indoor settings, where a lot of people are congregating for something that isn't very important, something that isn't a priority for my family or for public health. And so that would be my advice to anyone. Be prudent. I've gone out to restaurants in Connecticut, but I've done it outdoors, so I think you just have to be prudent about what you do and decide where you're going to take certain risks and where you're going to exercise caution.
If you were invited, would you go?
I would not go.
Okay. Thank you, Doctor. I think we've explored your personal life enough.
The Hartford Courant.
Hi there. First of all, I'm curious about the 8 deaths yesterday, 9 today, after much lower numbers for a while. I know cases aren't going up, hospitalizations aren't going up. So what does it mean that all of a sudden we've had more deaths these past 2 days than we'd been seeing for several weeks before that?
Any thoughts?
Yeah, Alex, thanks for the question. We're trying to pick that apart and dig into that a little bit more. The numbers are still relatively low, given the, like on a 7-day average basis. And as you know, because you follow this data closely, sometimes the death reporting lags, right? By the time it gets reported, especially if it's not in the hospital, there can be some time delay there. So we are looking to dig into that. I wouldn't read too much into it right now.
And I also had a question for Scott. So we're hearing about some projection systems that say that Connecticut is maybe due for some increase in transmission, or maybe has already had some increase in transmission. Do you think that is the case? Is it possible that our levels can stay this low long term, or even before the spike in the fall, are we due for some sort of increase?
Well, I think that it was a little bit of feedback, but I think the question is, can we have this low level of transmission and maintain it? Is that the essence of the question?
Yep. Yes.
Yep. Yeah, look, the state's doing a lot of testing, so I'd have reasonable confidence that if there were large outbreaks underway, we would pick that up. Certainly if there's introductions happening and small chains of transmission getting lit, we might not detect that. But if there's large outbreaks underway, I think we would detect it because we do have a lot of testing, certainly relative to other states, but even on an absolute basis, if you look at testing per capita. Is it going to stay that way? I think it's going to be challenging for a state that has as much movement in and out as this region does, this whole region, to avoid a lot of introductions given the amount of infection there is around the country. So I think we need to be prudent and understand that this may become a confluent epidemic at some point this fall, winter, as we collide with flu season. When you have a situation where everyone who has a respiratory infection in the fall or a febrile illness needs to get ruled out for COVID before they can get treated for para-influenza, influenza, mycoplasma, RSV, or other kinds of coronaviruses, that's going to put a lot of pressure on the healthcare system and our testing capacity to keep up with this epidemic. And at some point, you could have an epidemic that is widespread this fall or winter as this collides with flu season. And that's why I think it's important, again, the reason why we're here today talking about schools, it's important to try to get as much in as we can while we can, because we may not be able to, keep schools open for the remainder of the year.
Thank you.
Hearst, Connecticut Media.
Thanks, Max. Hey, can everybody make sure that they're muted? We're getting a bad echo. I've got a question for Dr. Gottlieb. The governor started things off by talking about surveys showing that 15 to 20% of parents might not want their students in the classroom starting the school year. Do you think that's a good idea? Would you recommend that 1/5 of the students stay home just to lower numbers?
Well, I don't think 1/5 of the students are staying home to lower numbers. I think, perhaps 1/5 of students might be staying at home because their parents have exercised discretion, and I think should be left to parents. And so I would never second guess the decision of a parent to decide to homeschool their kids. A lot of kids are homeschooled on a normal basis, let alone in this environment. I think that parents need to make decisions based on what their ability is, whether they can homeschool their kids, and what they think the risk is to their children. Some children are at higher risk than others, and so the parents need discretion to make decisions to keep their kids home. A child who is asthmatic or has diabetes is in a different situation than a child who isn't, and a parent may make a reasonable decision to keep their child home based on their assessment of the risk.
Governor, wouldn't it be a good idea to lower school populations though by 20% anyway?
Yeah, but I agree with what Scott said. We're not influencing that. We're letting parents make their own decision. But you're sort of right. I mean, in this sense that parents are going to be cautious. Some school kids are going to stay at home. That's going to open up more space within the classrooms. Just like many people don't want to go to an indoor restaurant right now. So even though we've got it capped at 50%, there are fewer people in there because it takes a while to catch up. So there is some positive self-regulation going on, Ken. You're right.
And Governor, has the contact info procedure started at Bradley yet? I listened to Kevin Dillon on the radio yesterday, and it sounded like it hadn't started, but it's going to start soon.
I think it's going to start soon, probably early next week, if I had to guess.
Are we still getting positive reports on mask wearing, social distancing? I noticed there were some bars or some restaurants in Danbury that had to have police action on them over the weekend.
There are some incidents that we're being notified of. As you know, if you don't feel comfortable telling the proprietor that people should be wearing their masks, and that's the rule, you can dial 211. We notify local public health or give people a strong reminder. There's some lax attitudes out there. We're trying to take that seriously.
Thanks. And one more for Josh. Josh, anything preliminary on the nursing home investigation through the consultant?
Yeah, so the consultant's been, the contract was awarded, as I think we announced last week, to Mathematica, a policy research firm based in New Jersey. That study is underway, so they are on board. They're starting their research, their collection, their interviews, so it's off and running, and we expect an interim report by mid-August.
Thank you.
The Waterbury Republican American.
Thank you. This is a question for Scott Gottlieb. Could you perhaps elaborate on what makes you confident about the school reopening plan? There are certainly plenty of teachers and parents who think it falls short. So what is it about it that gives you confidence?
Well, look, nothing's risk-free, and I don't think there's any plan that's sort of foolproof. I think the cohorting, trying to keep the students in small pods so they're not intermingling with a large population. So if you get a single introduction, you don't have as much risk of widespread. I think the use of masks is prudent. School districts are going to try to implement distancing where they can. They're looking at trying to retrofit air conditioning systems with better filtration, and I think some school districts are going to be able to achieve that. Those are the elements of what you'd want to see. I mean, the only other thing you could conceive of is taking steps to de-densify the schools further with staggered school days or staggered schedules where the kids aren't in class 5 days a week but are brought back for 2 days, and so you try to use that to reduce the school population. That would be the only other element that I've seen in other plans that you can introduce here. But I think with the use of masks, you're achieving a lot of risk reduction. And so you have to sort of pick what you're willing to do in these things.
And Governor, what do you have to say to folks that are still concerned that the plan is not up to snuff?
Well, the plan is up to snuff, but I understand people have a caution. We were hit hard. COVID is a pandemic. You see what's going on in other parts of the country right now, so there's necessary caution. My instinct is that maybe some parents will be hesitant at the beginning, but I sort of agree with Scott. We have an opportunity for kids, many of whom have not had real learning, or at least classroom learning, for months now. Even if I can get them in the classroom for a few months, what a difference that makes. I have no idea what COVID looks like later this year. We have an opportunity to give these kids a head start. I just think it's something we ought to try and do. And I think we can do it safely.
Okay. And Scott, you mentioned several times about the possibility of schools having to close down. What's your expectation? Do you expect to see schools having to close down again here in Connecticut and elsewhere?
Look, I'm very concerned that at some point we're going to see a national epidemic, that, this is a virus that wants to infect 50 or 60% of the population. Only a small percentage of the population at this point has been infected. And as you get into flu season, this is going to spread more widely, and we haven't had the ability to control it. We haven't shown the ability to contain it, and there's a lot of infection. I think at this point, many of us hope that the infection level would be much lower, and we'd be heading into the fall with much lower levels of infection, so we can use case-based interventions like testing and tracking and tracing more effectively. But when you have this amount of infection around the country, those systems become overwhelmed. So yes, if you're asking me where I think the base case is on where we're going to be later in the fall, the winter, I think that there's a significant risk that we're going to have more widespread across multiple states, multiple regions.
And we heard from Dr. Carter, the state epidemiologist, earlier this week that this isn't shaping up as something that is going to happen in waves. I think the term you might have used is continuous transmission. Yeah, obviously, you're in the sort of same field. What are your thoughts on that?
I didn't quite get the question. You said there's going to be continuous transmission?
Yes. We've heard about waves coming, and Dr. Carter earlier this week said it's not really going to be waves. It's just going to be one continuous outbreak, so to speak.
Yeah, I mean, that's basically what I'm saying. There's a little bit of feedback. I apologize. I think someone's not muted, but that's basically what I think is possible. That this isn't good. Right now, we've seen sort of an epidemic in the Northeast and an epidemic in the South. I think in the fall or winter, we could see what we see with flu season. Flu starts as a regionalized epidemic, and then eventually we get a sort of national epidemic of influenza. There's a risk that COVID is going to look the same way, that we're going to have a national epidemic of COVID at some point as we head into the fall and the winter, which is the natural season for a respiratory virus like this to be spreading. So that's what I would be, worried about. That's what I'd be trying to guard against right now from a policy standpoint.
Okay, thank you very much.
All right, I'm getting the signal here. Dr. Scott Gottlieb, I got to thank you. I'm so glad that Connecticut is your home state, and you've taken such interest, and I treasure your advice, and thank you for doing this. We've had a number of PSAs about don't take a risk, wear the mask, and you've heard from one of our leading grocers, you've heard from one of our leading basketball coaches, you heard from one of our leading lifeguards. And in honor of Professor Gottlieb, let's hear from a professor, another professor.
People ask me, is it hard to figure out if I should get tested for coronavirus? Well, as a professor, I love giving a pop quiz. Are you experiencing fever, chills, cough, shortness of breath, fatigue, or body ache? Well, then coronavirus testing is available without a referral, and it's the best way to protect yourself and your family. It actually reminds me of Plato, who once said, "The price good men pay." Okay, I deserve that.
Have a safe weekend. Take care, everybody.